I'm excited to sit down with my next guest because he works for a company that's been doing business up here in Canada for a long time. In fact, they were investing in Canada long before their US counterparts. I'm excited to ask him what they're doing in Canada and what exciting new projects they've got on the go. Hello and welcome to Healthcare IT Today, where we bring you the latest insights and interesting stories from the world of health IT. I'm Colin Hung, and I'm here at the eHealth conference in Vancouver, and I'm about to sit down with Bob Molloy, who's the Director of Canadian Operations at Meditech. He's going to talk to me about one really interesting Canadian initiative that they've got on the go to help with our interoperability challenge. Let's get to it.
Well, good afternoon, Colin. My name is Bob Molloy. I'm the Director at Meditech for our Canadian market and product strategy.
And Bob, what are you doing here in Canada? What are some of the exciting things at Meditech? Because we see you guys all the time in the US, of course, but what are you doing up here in Canada?
Well, over the past couple of days, we've spent some time here at the eHealth conference, which has been great to see the other vendors. A lot of our customers are up here. And we're just trying to understand what the needs are, and that's my role in the market and the strategy to figure out what people need, how we can connect. And I think it's been a good opportunity to meet with a lot of people, be it existing customers or prospective customers.
And now, Bob, you were telling me some of this exciting things you're doing with Meditech Traverse. What is that, and why is that so exciting?
Yeah, I think we interchange the word tech or Traverse Exchange Canada. So with Traverse Exchange Canada, we've really emphasized an interoperability strategy. We've created this network where we can share and exchange patient data. In particular, at present, we're exchanging patient summaries, known as the CCD. We really built that on the foundation of what was done in the States for a lot of years, but bringing it up here so our hospitals, our organizations can share that data. And under Project Amplify in Ontario, we also wanted to bring along the point-click care or long-term care facilities. We have more than 400 hospitals. Our hospitals are connected to more than 400 long-term care facilities right now. So we are truly exchanging data with acute and long-term care facilities, which has been really remarkable. We've done this in about 1 year's time, and it's really taken off. We're delighted where we are.
And you were explaining to me, in fact, you corrected me, Bob, because I called it like the HIE here in Canada, and you were like, no. It's a federated model. You actually don't keep the data in the exchange.
Yeah, I'm glad you mentioned that. So it's really a hub and spoke methodology. And on the spokes, we would call that the federated model, where data resides in the original source, and we're a pass-through opportunity. So if a patient was to visit a hospital or an acute setting, or to be transferred out to a long-term care setting, we can reach to those sources and serve that up. In our hub, we have a record locator service, so we know where the patients have been, and we can serve that data across, really pass-through opportunity. And it works better. I think keeping that data in that federated model is a nice way to handle the data sovereignty, if you will.
And what are some of the other exciting things that you're working on at Meditech up here in Canada?
Well, I just went through the network for exchanging patient summaries, which is really moving a lot of boundaries here. But we've also started to connect to, in Ontario, we're working with Ontario Health to connect to some of their provincial assets. Convenient access to that great repository, in this case, the lab results are all in OLIS, or Ontario Lab Information System. And by connecting to OLIS, we can pull that data right into our chart in our EHR solution, so the provider or caretaker could see those labs in one system, not having to launch to another system to explore what's out there. Keeping our users in the same system is really paramount. I think there's a help to that. Anywhere that we can eliminate the need to launch elsewhere is powerful. And that's the first one we're connecting to, but we're likely to move into other provincial assets, be it a DHDR or Digital Health Drug Repository. And while we're doing this in Ontario, we are shifting some attention over to British Columbia to bring that same connectivity into the chart for the provincial lab information solution. And PharmaNet has medication details. So I see these as pretty exciting movements we're making right now.
And Bob, you shared a lot of great information. Where can people go to learn more about Meditech in Canada?
Well, we actually have a space on our website. So if you go to meditech.com and there's a backslash that will get you to the Canada, and some of the things I've spoken of are listed there. So we want to make sure our Canadian customers are aware of these initiatives. And then we also have some current events of where we're maybe visiting next and or hosting some events. We'll have some summer events. We have a fall event. We try to come to these types of events, but we also are hosting, and some of these are virtual and some are in person. So all of that can be found on our website.
Awesome. Bob, thank you so much for being on our program today. It's been great having you.
Thank you for having me, Colin. It's a pleasure speaking.
Hey, I want to thank Bob for coming on camera with me and sharing some information about their really cool initiative around interoperability that's using a federated approach rather than a consolidated data approach. I hope that it has legs and it takes off in Canada because boy, do we need more interoperability. And hey, if you enjoyed this video as much as I enjoyed making it, please like and subscribe. Also, head on over to healthcareittoday.com where you can get more great content like this. I'm Colin Hung here in Vancouver, British Columbia. Thanks for being here, and I'll catch you on the next video.